We are joined now by Aliyu Ilyas, who is an economic analyst. Thank you very much, Doctor, for joining us on Business Daily this morning.
Thank you for having me. Good morning.
Doctor, you have heard from most Nigerians on social media, and one question, Nigerians are said to be the biggest or major asset that Nigeria has. But having heard from the commenters as regards to human capital development so far, what are your thoughts, especially in the area of how Nigeria has evolved over the last 2 decades?
Right. I think human capital development has a positive correlation to economic growth. So the more you develop your human capital, it will also reflect in your economic growth. So it's a reflection of what we have done so far as a government and as an entity to develop our human capital. You could remember when we were in region, we said that a particular region give their people free education, and it reflected on the productivity of that region. So I think we should look in that direction. We need to do more and invest more in human capital.
Indeed, some work has been done, like you've rightly stated, but there is still much more to do. So what I'd like for you to, reflect or be more specific, talking about the key milestones that have been witnessed since 1999. Which ones will you highlight as the major milestones in the area of human capital development now?
Right. If we talk about human capital development, I'll be speaking the negative side because most of our human capital development that we have invested on has been a sort of brain drain. So if you look at most people in Europe now, if you go to America, go to UK, you see Nigerian doctors who are doing well. They have jackpots, as it is said, and they are performing well. Those are human capital that we have developed in Nigerian university. They are going through medical school in Nigeria, but find their way outside. So, and coming in now, I could say we are still basking on average in terms of human capital and its correlation with economic development in Nigeria.
Well said, Doctor. But let's go on a short break. When we return, the conversation continues. Dr. Aliyu Ilyas is still on standby, so do stay. And you're still watching Business Daily, coming to you live on Trust TV. And just before the break, we started a conversation on the switch over of Nigeria from military rule to a democracy. And it's been 25 years so far. But how has, this impacted not just on the economy in general, but on human capital development so far? I still have my guest with me. He is an economic analyst, Dr. Aliyu Ilyas. Thank you again, Doctor, for coming on Business Daily.
Thank you for having me.
Good morning. Before the break, you said something that stood out for me. You talked about brain drain. Right. And that brings us to the area of, healthcare, which is, it's no longer news that on an annual basis we have, a mass exodus of Nigerian medical practitioners, to other parts of the world to practice in those parts of the world. How would you say, what message does this pass, in the area of human capital development, and specifically in the health sector, seeing, this happen and the healthcare services that Nigeria has, healthcare infrastructure, generally speaking, the healthcare sector as a whole?
Right. I think this has a two way of looking at this issue. One is the human capital development and the issue of health. Because a healthy man would definitely perform better. Because if you look at our PHC, primary health care, how many do we have? How many do they cater to? Because the more people are okay, the more they perform well. And the other part of it is the issue of brain drain. Now, it is clear that in Nigeria today, if there's any exodus of people, which is health care personnel, there's serious exodus on their own part. And what does that amount to? It amounts to brain drain. I can tell you that globally, Nigeria have one of the cheapest medical education, right, in terms of cost implication. Because if you go to Ghana to study medicine, you know how much you spend. If you go to UK or you go to America, I can tell you, you spend a whole lot to study medicine, let alone go to medical school. But this should have been our investment, whereby people across the globe will come for Nigeria for healthcare. But the opposite is the case now. Our Nigerians are now the highest doctor in UK, the highest doctor in America. And it's because of we do not manage them very well. And what does that do? That means we are having negative internal issue in terms of health workers. So now what we should have been again, our human capital development, it has been eroded and it has followed the trend of jackpot. So a lot of them are in abroad working. So what are we now gaining from there? So if Nigerians have a good conducive environment, they would have been here and wouldn't have go for medical health in India, in America, or in UK, across the globe. So I think that's part of our Nigerian issue. So we should also find a way of retaining them. A medical doctor at our general hospital in Abuja, how much are they earning? So because they are not earning well, they will have to move. And what does that portend? It simply means our human capital development that we have expended money on out of Nigeria. So it's a serious issue that we must look at very well. Because if you look at UK now, if you look at China, Indian, their major earner is in health sector. So, and we are not doing well in that area.
I remember during I would say the COVID-19 situation where we had, health workers at the forefront and working round the clock, to ensure that people were, taken care of. And I remember during the time we had, a lot of conversations around how poor the medical field or workers in the medical field currently are earning. But how has that impacted, in the life expectancy of Nigerians? Because if you have people tending to you and are not, satisfied with what their job is giving to them, is this in any way going to impact on the lives of the patient?
Right. If you look at the Human Development Index, it look at three indicators rather. It look at health, that's life expectancy of people. It also look at education, how many dropouts do we have, and lastly, it also look at per capita income of individuals. So let's look at that life expectancy. The fact remains that how many patients to how many doctors? That's a serious question that you need to ask. I've been to a lot of public hospitals. You see people sitting down, 100 people sitting down to actually get to see a doctor, and it's only one doctor. Remember, they also do shifting, and when doctor is tired, he will be waiting for the next person. It's not that we don't have maybe medical school that are training these people, but the problem is that the exodus to abroad is the problem. So it must look attractive in terms of the pay we give to our medical doctor. It's very, very key. A medical doctor, because he has no other business than business of taking care of people, should be taking care of that. He will take care of all his basic needs. And this is what is happening abroad, because if you go abroad and you're a medical personnel, you know how big you earn. So I think that's what we need to look at. So we need to find a way to keep them here in Nigeria. And because what I remember, the Ngigi, the then Minister of Labor, he said we don't have issue with medical doctor, medical personnel, that we churn out a whole lot of them in it. But how can we invest so much that a lot of things are like free for them to an extent, and they now move out of Nigeria? So I think we should take care of that, because that would have helped workers too, because when someone is sick, it's pretty difficult for the person to function very well. I can tell you this season malaria is everywhere. How many people are being catered to in terms of malaria, and how is it going to impact? Because you have to look at the level of time expected to take care of yourself before you now go to work. So health is a major factor in terms of human capital development.
Indeed, doctor. And what comes to mind now is, budgetary allocation so far. Over time, I mean, if you look at the figures year after year, the health sector usually would have about 2% or less of the entire budgetary allocation. What do you have to say about that?
I think this present government has tried, because I think the budgetary allocation for her is quite high, and also there is a square peg in a square hole. We have a minister of health and social welfare who is well trained, who knows about health. I think his area is even more vaccine. But this person, remember, the name has even changed from Minister of Health and Social. So I think by now, all citizens of Nigeria would have been captured in NHI health, because I think that's the idea of social welfare that is added to Minister of Health. So I think we should all be on insurance, because health is not what we plan for. It's cool. Someone could fall sick at any point in time, and you now start looking for money to actually take care of yourself. So there should be a comprehensive health insurance scheme, right from the federal to the state, and it should not be only for the government workers. They should also look at private, because people that work in government, I'm not sure they are more than maybe 15% of the population, which could be amounts to maybe 26 million. What about other 170 million? What is our hope? So I think government should design it as expected to have an health insurance cover for everyone.
You've touched on the National Health Insurance Scheme, and what comes to mind is the policies we've seen so far directed at the health sector. In what way would you say they have improved the well-being of Nigerians in the area of health, maternal health, child health, and just health in general?
Right. Well, we want to give this government benefit of that, but it's 1 year already, so we expect the minister to have come up with a policy roadmap on how to cater to people's health, because even the PhD that we have, I don't think it's enough, and not being enough alone, it should be well equipped. And when we talk about, we won't look at only federal government, states should also invest in health and that's why we are always asking for local government autonomy, so that local government can manage, handle, equip their primary health sector of their own area. It's very, very key, because health is not what you plan for. Anything could befall anyone.
Indeed, health is key, like you have stated. But doctor, let us talk on the area of education right now, which is one of the metrics when calculating the human capital development. And over the years, we've seen or had conversations around achieving universal quality education in Nigeria. How would you say that is going so far?
Now, in as much as I think Nigeria, we need to develop a knowledge economy. A knowledge economy has to be driven with education. I want to talk about education. I think Nigeria is becoming something else when it comes to education. You recall our fathers, our grandfather, rather, I wouldn't say my father, our grandfathers enjoy free education. And when people enjoy free education, it reflects on the human capital development, and consequently reflects on economic growth. You remember, I think Southwest, led by Awolowo, gave the citizen of that region free education. I can tell you, go to every household in Yoruba, in the western part of Nigeria, you see that majority of them are well educated, and because they are educated, it reflects on their life and it brings about economic development there. And that's why we said the Yorubas are more educated. It's just a function of what? Free education. So I think that's where we need to look at. There should be, I think for now, there should be free education from primary to maybe secondary school, even to university level. It does not cost us an arm or a leg. It's just about budgetary allocation and seriously planning for it. If you look at China, why is China at where they are? It's because of education, knowledge economy, whereby people don't only go to school, they go to school to learn something very good. And another thing is, I think NUC need to look into our curriculum, because what we are doing is quite archaic. It's not helping us in the economy. For a good example, somebody who studies physics, right, at BSc level, sometimes you will end up being a teacher, right? But if you study physics and electronics, it is obtainable even in Ghana and other places. People don't study business. You have to attach business in agriculture, business in computer science, so that these people can actually reflect and bring it in. Like myself, in first degree, I study economics. This age, you don't study economics, you study computer economics, so that you can regress, look at inflation, and look at all that. So I think our curriculum is the major, and that's why if you look at China, they are more practical. They produce different things because they look at skill, vocational. So it's not only a first degree. Our polytechnic should be up and doing. Our technical school should be up and doing to produce people that will really help. So when we talk about human capital development, I think education is key. There must be free education to a larger extent. There must be focus on skill development. I think now we said every courses you study, you must study entrepreneurship. So we should go beyond that basic entrepreneurship to practicalize those things, and also there should be fund. They should fund research in this area. I think education is the key. So to have a knowledge-based economy, there must be fund, there must be free education, and it must not only be federal government. States should also focus. I think before, every region is being known for something, so we should start looking at that. We have 774 local governments. How in Bayelsa, people that are doing fishing, how do you equip them? Because education is beyond four-wall class.
I mean, it's beyond just formal education.
Exactly. So there are other things. So if you are doing fishing, how do you improve on your fishing, whereby instead of you catching 100 at a time, you catch 1,000 at a time that to be much more mechanized, more, use more scientific methods. So this is the way we must go, and it will reflect in the economy and growth of Nigerian economy.
Well said, Doctor. I would like for us to talk, on the employability of the Nigerian youth. I mean, every year from diverse schools across the nation, Nigerian graduates or schools churn out graduates in their numbers. And then we have, the problem of the Nigerian youth not being employable. Well, first of all, let me ask you, do you believe in that saying? Because it's been repeated over and over again.
100%. So I think as a Nigerian youth, you need to ask yourself, are you employable? It's a very good question, because it's beyond now. Education or training is beyond that 4 class that you have earned. So if you study a particular course now, like I said, our course is getting archaic, and it's affecting the employability and competitiveness of Nigerian students after graduation. Because now, if you are a graduate and you do not know how to operate computer, you do not have any understanding of a particular packaging computer, be it MS Word, be it Excel, Power BI, you just have to equip, because now you don't have to rely on the only thing you study. That's why there are professional courses. If you look at some private university in Nigeria, if you're studying accountancy at some private university, they will enroll you for either ACCA, either ICANN, either ATS. They want you to be. So as you are graduating, you are also graduating as a professional. So we must look at professionalism and education. So when you are studying, you must also look for a way of being a professional. So you will be employable if you have extra knowledge. You can't just come and say you are a BSc holder or HND holder and you cannot operate a system. It's a problem. And that's why we say what we are churning out, even in our university, there is this for us to work on it. So as every graduate, you need additional knowledge.
But doctor, because one thing, people say a lot that the Nigerian youth is unemployable. But however, when they leave the shores of Nigeria, you find them excelling. So is it the environment that is limiting the potentials of the Nigerian youth? Or is it the Nigerian youth himself or herself that is refusing to, grow and excel, like you stated?
I can tell you that we're in a global world now. So you need to do more by yourself. And by the time they get to those places you are talking about, they usually have a short courses, 3 months, a further training, a retraining, on the job training that will make them to be employable. If you look at it, I have people in Nigeria who is doing coding for companies in America. Do you know why? It is cheaper to employ a Nigerian who will be working remotely for you while you are abroad. It's simply because these people have gone extra mile to actually. So we must look beyond what we are studying to also go to being a professional, because the world is not looking at being maybe somebody who just somebody who even study mass communication. Mass communication also go beyond the 4 class. Sometimes you need to do research, you have to be digitally inclined, and a lot of, so it's like that. So for you to be employable, at the point of interview, people will not look at what you study only, they will look at what you have bring to bear in terms of additional skills that you have. So we must always look at, and that's why we tell people that are doing NYSC, and that's the meaning of NYSC, because by the time you graduated, they expect to go and serve. When you serve, you are expected to do your service where you can get practical knowledge for that 1 year. So after that 1 year, by the time you are going out, you are not going out with only your certificate, you're also going out with that professionalism that is in you already. So it's key that you make yourself employable as a Nigerian graduate.
Well, I'm glad you made mention of the National Youth Service Corps. The initial, or the reason why it was even introduced, and looking at other, introductions in the area of policy, for instance, the Empower program as well. How would you say initiatives such as the NYSC, the Empower, has really impacted in the Nigerian youth? Has it been of any positive? Because I hear people say, oh, I don't think I need NYSC at this point. So what are your thoughts on that?
Right. I think we need to score NYSC too, because they introduced what is called SAID. I don't know if you know what this simply means. So what is SAID? SAID simply means you must, within that 1 year, study a particular profession, so that you can actually add it to what you actually have. But we must also talk to Nigerian youth. Quick win syndrome is a problem again. Most of us want to find a shortcut to really excel. So I think that's the part. But I think SAID also should be monitored by NYSC the more. And it also spoke about Empower. I can tell you that some of my research is in Empower. It has benefited some people who take it consciously. Because I recall even during Empower, the supposedly students or graduates are supposed to study will now connive with the person supposed to monitor them. Instead of them to go to that work, they will be sharing the amount, and they are the losing end, because if you are attached to a particular hospital, they want you to have a study, and after 2 years or after a year, you can use that experience to actually apply. So I think we should be more strict in all this. So if you are more strict in it, it will be to the benefit of the Nigerian growth. Youth exuberance is a problem. All of us want to just do something quick money. But if government can also find a system that will make sure it conditions that student with monitoring, because if you look at Empower too, it has about 5 areas: NTech, NTax, NTeach. They now have the last one, which is called N Monitor. So what does that N Monitor? That N Monitor is supposed to monitor all the people in this scheme to make sure they really follow what they're supposed to follow. So if we follow it properly, Nigeria is always good in documentation, in designing of policy, but implementation is always a process. So I think we should do more in terms of implementation of those policies.
Doctor, you mentioned something. You said that the human capital development level that Nigeria is in is, a picture of the Nigerian economic growth.
Yes.
And looking at that now, I mean, over the years, there has been talks around economic diversification, but not so much has been done. But I would like to hear you. Is there a relationship between economic diversification and human capital development?
Right. I think economics is even diversified beyond what we are even thinking in Africa. No, the world is now based on knowledge. So everybody is pushing their people towards a knowledge. And what is the knowledge here now? We are now in a digital world, a technology-driven economy globally. So Nigeria needs to focus on it more and make sure that, I think NITDA or one of the agencies looking at that area, whereby I think I listened to one of the government essay who said that, okay, it's Minister of of Communication and Digital Economy. So they have a marked number of people that they want to take maybe per quarter to really learn some area of technology, which is very, very good. So I think we should also be diversifying alongside the global world. Every area now is being attached to to technology rather. No, let me say fintech, and that area is what we should focus on. That technology in everything you do. Is there any area in the world now that is not driven by technology? No, but Nigeria are not there already. Look at our agriculture. Look at our engineering services. Look at a lot of things are not attached to it. I think the area that is enjoying that more is fintech, and our fintech also is being eroded by people that are calling them outside to come and actually work for them. Because if you look at our Nigerian banking system, I think it's the best one you can ever think of now in terms of the development in technology. And because of that, people that are expert in that have been taken away as well. So I think we should look at that brain drain in that area again to find a way of retaining those people, or they work globally. It's a global thing. Find a way of, if we work globally, we can take from it. Another thing is that we have also worked in technology is I would like call it film industry. Are we going to use film industry? Because it also has to do with music and what have you. See the way people are streaming online now. It's also to the benefit of the Nigeria economy. Nigeria is supposed to get something from there because we have invested in that area. So I think government should look at that area, human capital development in that area also, and that will benefit Nigeria the more.
Okay, shortly, Doctor, before we go, you touched on the tech industry, and that is a sector that most youths are, gravitating towards these days. And we've seen quite a number of tech industries attract venture capitalists with huge amount of sometimes in some cases, over $200 million and high amounts such as that. But let's talk about the policies now in that sector. There's been quite a number. I mean, we saw the Startup Act being enacted, I believe that was 2 years ago, directed at the tech industry specifically. And there has been quite a number of other, policy directed at the tech sector. But how would you say that is going, and is what we are seeing enough?
Right, I think it's an evolving area. So when an evolving area is coming up, it attracts a lot of attention, and when it attracts a lot of attention, it attracts policy making as well. But I think the problem we are having in the tech industry is about regulatory problem, because you could see that CBN, is trying to work on fintech, right? NCC is working on fintech, and NITDA is also working on fintech. We also have sometimes FCC, PC working on fintech. I think Nigeria needs to do more in terms of maybe establishing a new area that will look at that area specifically, because it's a big area that we need to monitor, and we must also not strangulate that area from growing, because if there is too much policy making, too much policy direction, it always brings a level of problem. Look at the loan shark. You know, it's a technology application, but who is actually monitoring loan shark? Is it CBN? Is it NITDA? Is it NCC?
I believe it's the FCCPC.
It's not part of their jurisdiction. That's the question. They are not to regulate. Now they have to develop a framework, and that's why I said either we have a new commission or a new agency that will monitor financial technology, because it's a vast area. Because we are only looking at financial technology from banking sector. How about insurance? Insurance is supposed to be on tech too. You know, pension is supposed to be on tech too. So they are a very big area that I think government need to look at policy making in that. But my suggestion for federal government is they should look at a new body that will monitor this area critically.
So much to talk about regarding the human capital development so far since Nigeria's emergence into a democratic rule, 25 years down the line, and we have spoken extensively as to how that has impacted human capital development. Thank you, Dr. Aliyu Ilyas, for all the insights that you have shared on today's edition of the program.
Thank you for having me.
Well, this is where we draw the curtains on today's edition of Business Daily. But join the conversation on social media. Let us hear your thoughts on the discourse of today. My name is Chiamaka Enendu. Thank you for watching, and bye for now.